Hello. We are here with another episode of Let's Talk Health. And what we are going to talk about is what are the evidence-based nutritional medicine strategies for managing the PCOS. Hello. My name is Qurat, and I'm a senior nutritionist and wellness consultant in Hong Kong, MBBS licensed in Pakistan. So let's talk about what is PCOS. It's basically a common hormonal disorder affecting women of reproductive age, often leading to irregular periods, excess androgens, and ovarian cysts. So if I cut it down into smaller words, it's actually a misnomer, meaning what does it say it doesn't mean, like polycystic, having so many cysts in the ovary, syndrome, leading a group of different diseases. Actually, what it says, sometimes it does mean that, but it doesn't mean that all of the women with PCOS have ovarian cysts. So let's talk about what is the prevalence of PCOS. It's basically it's a common endocrine disorder and affects up to 1 in 6 women of reproductive age. And it's pretty common, and different criteria of PCOS depends on the geographic and ethnic variability of the presenting symptoms. It also depends on the lack of specificity of the symptoms, timings, and presentation. So according to research and different published journals, its variability depends on these factors. Let's talk about what is menstruation cycle in PCOS. Does it really affect it? Yes, it does. Actually, in order to understand how it affects your menstruation, you need to understand what the menstrual cycle is. So, as according to this slide, you can see it here. It's basically a combination of 4 phases: the follicular phase, ovulation phase, luteal phase, and the menstrual phase. So it starts on the menstrual phase, but then it takes around 28 days to complete one cycle. So it's really important that your follicular phase and ovulation phase are accordance to the number of days, more or less, according to the natural cycle. So if your period is irregular, for example, it comes more frequently than 21 days, or it becomes more than 35 days, so the length of your cycle depends on the hormones that are regulating your menstrual cycle. So it's important to know that whether you're having amenorrhea or you're having oligomenorrhea. Amenorrhea meaning having absence of menstrual cycle, and oligomenorrhea means having infrequent periods. This is important to understand that these symptoms are part of your PCOS. So once this is clarified, let's move on to your ovaries in PCOS, how they are affected. So basically the PCOS ovaries are the accumulation of cysts in your immature follicles. So in the normal ovary, there is a whole cycle of perimodal follicles, primary follicles, secondary follicles, and mature follicles. But that cycle is blocked due to some factors which we're going to discuss later. And once that is disrupted, your normal development of the ovary is basically stopped. So you start having multiple immature follicles, and those immature follicles are stuck inside the ovary, and they can't mature enough to release progesterone and other hormones which are regulated in your menstrual cycle. So let's talk about the hormones in PCOS. The menstrual cycle is regulated by FSH, follicular stimulating hormone, the estrogen, the luteinizing hormone, and your progesterone. So during your menstruation, your FSH value is a little low. And once it starts to ovulate, reaches the stage of ovulation, your estrogen and luteinizing hormone increases in concentration in your blood. Once your egg is released from the corpus luteum, that corpus luteum releases the progesterone, and that progesterone is so important in the regulation of your menses. Now, what imbalances do you encounter in PCOS? Your hypothalamus is basically the main signal releaser to promote the production of FSH and LH. Sends the signal to ovary, and then that ovary increases the cortisol and androgens, and those androgens are released from the adrenal glands, resulting in lots of testosterone and insulin resistance. So this mechanism is important to understand before we further move on to the symptoms, because this hormonal imbalance is the main core of the problem in the whole of this disease. What do you see as in your skin in PCOS? Does your skin get affected? Yes, it does. You see dark patches or skin tags on the skin. A lot of acne because of the oil production. So your whole skin is basically regulated by the menstrual cycle, and it affects your skin changes. For example, in your menstrual phase, the skin becomes dry and dehydrated. You're more prone to have atopic dermatitis and contact dermatitis, while in follicular and ovulation phase, skin is usually calm, plump, and radiant, becomes beautiful, smooth, and it's best around ovulation time. But in the luteal phase, 70% of the women experience mild acne, greasy hair, eczema flare-ups. Skin is more sensitive to irritants. So once you understand that how your skin changes are linked to the menstrual cycle, you will understand that your skin is basically controlled all by these hormones. So how do you diagnose PCOS? In medicine, there is a Rotterdam diagnostic criteria to diagnose the PCOS. So there has to be 2 out of 3 criteria. Number 1, either one should have clinical hyperandrogenism, or irregular menstruation, or polycystic ovaries on having an ultrasound checkup. So any 2 out of these 3 has to be positive in order to diagnose it as PCOS. So the question arises, how often is amenorrhea related to PCOS? Let me clarify, what is amenorrhea? Amenorrhea is lack of menstruation. And the other question arises, how frequently does PCOS occur in women of reproductive age? So polycystic ovarian syndrome causes 85% of oligomenorrhea, means infrequent menstruation, and 30 to 40% of amenorrhea. So these were the facts and figures you can see on the slide, that how much percentage it affects in the reproductive women age. So does it one size fits all? Well, no, that's not correct. PCOS criteria does not fit everyone in that. So there are different phenotypes A, B, C, or D. So according to the Rotterdam criteria, one has to have either of the two, as I explained before. Either they can have all three symptoms of hyperandrogenism, or oligomenorrhea or anovulation, or polycystic ovaries, or they can have phenotype B, having only the oligomenorrhea or anovulation or hyperandrogenism. They can have phenotype C, which includes the polycystic ovaries, does not have any menstrual irregularities, but have higher levels of testosterone and androgens, or phenotype D, which includes the menstrual irregularities, polycystic ovaries on ultrasound, and no hormonal imbalance. So this is important to understand, that which criteria of phenotype that you exist in. So you can't just diagnose yourself on this basis. You need to go to your health provider and get yourself diagnosed properly. But this is just for your general information, that you could lie into any of the phenotype and you might not know it. So it's better to go and get yourself checked. So does this PCOS affect only females, or does it affect males as well? Surprisingly, it affects both male and female. As I said, PCOS is a misnomer, so it affects the males and female both. So there is an equivalence of PCOS disease, and it affects basically male as well. So how does it affect it? In addition to the rest of the symptoms that we're going to discuss later, the male equivalent PCOS affects the sperm motility, the sperm count, and sperm morphology. These three criteria, having low sperm count, abnormal sperm, or abnormal motility of the sperm, basically is seen in the males who are affected by PCOS. So, who is at risk of PCOS? Let's talk about the risk factors. It's really important to understand that all of these population that you see around yourself, who is more at risk. So the risk factors include genetic, the epigenetics, having unhealthy diet, environmental toxins or pollutants. Your being obese makes you more prone to have PCOS. Maybe your sedentary lifestyle or lack of physical activity is contributing to having this syndrome. So all of these factors are so important to understand, that PCOS is not only for females, this is also for males. So these risk factors contribute to both of the genders. Let's talk about the symptoms of PCOS. What could be the symptoms? Well, among women, it's irregular menstruation, as we discussed, having oligomenorrhea or amenorrhea, having ovarian cysts, as seen on the ultrasound, having hirsutism, which is the excessive body hair growth, or being more obese. Some people start having difficulty in losing weight. Some people have acne. It is important to understand that not all of these signs and symptoms are present in the affected person. You might have only few symptoms, or you might have all. So, as I mentioned before, the skin changes in the menstrual cycle also affects your skin. So one can have oily skin, or male pattern baldness or thinning hair on the scalp. So all of these symptoms are important to understand that these are just not the symptoms you can manage yourself. You need to see your healthcare provider, get yourself checked. You might see some skin tags, you might see some acanthosis nigrans, which is called the darkening of the skin. And the most importantly, when we usually see such patients or people is because when they start having trouble conceiving or they start having infertility. So that's the main factor when they start coming towards the clinics or they consult their healthcare provider. But it's important that earlier you come to your address your disease, the better the outcome. So what is the primary presentation in the symptoms? All of these may vary with the age. As I mentioned, skin symptomology, menstrual dysfunction, dyslipidemia, type 2 diabetes, which can also lead you to cardiovascular diseases and insulin resistance, most importantly. That is one of the mechanisms which leads to the proper syndrome of PCOS. What are the complications of PCOS? Because all of these things leads to different complications, right? Let's talk about it in detail. The long-term impacts of PCOS extends to metabolic and reproductive risks. It's important to understand that it's not only your skin, but also your metabolic health, your cardiovascular disease, your reproductive health, your endometrial cancer risk is all linked to PCOS. So once you acquire this disease, you're more prone to have complications, whether it be thromboembolism, whether it be infertility. So the question arises, I am obese or I am lean. Am I prone to PCOS? So does being obese or lean have anything effect on the PCOS? Let me show you something really important to understand, that there are two phases of PCOS. I mean, two different presentations. You could be in type A, which is the obese phenotype, or you could be in type B, which is the lean phenotype. So the type A is mostly related to insulin resistant and is the dominant phase. And in type B, the hormone balance is the dominant phase. So to understand your condition, you should also understand that whether you lie in type A category or type B category. So how does PCOS affect your fertility? As I mentioned, that PCOS can be affected by the male, or females can also be affected by it. So the low sperm count, the poor motility, the abnormal shape of the sperm also contributes to the infertility of the male. And the ovarian cysts once there is an ovarian cyst, there won't be an ovulation. More testosterone or more androgens are inside the body of the female. It'll affect the production of and the quality of the egg, ultimately leading to infertility. How does insulin resistance occurs in PCOS, and how does it affect your condition? So basically your pancreas makes insulin, right? And once your cells becomes resistant to insulin, which is responsible for pushing the glucose inside your cell, which is the energy production for the cell, it's not happening because the cell is become resistant, and the sugar stores as fat, and you feel tired and hungry all the time, and then you eat more food, and this vicious cycle goes on and on. This was the simplified version. Let me show you the complex version. Basically, the more the insulin is in your blood, it increases the testosterone and it decreases the ovulation. It increases the PCOS symptoms. So once the sex hormone binding globulin is released from the liver, it goes to bind to different androgens, leads to increase the symptoms of the PCOS. And once there's insulin resistance, there is more chance for your body to increase all of the food that you eat and adipose tissues, which are also called the fat cells. So your LH and FSH ratio is disturbed, all right? And there's hyperglycemia. Your body don't understand how to deal with it. It'll store it as a fat in the liver, around your organs, around your skin, and you're more prone towards having obese phenotype of the PCOS. So, is PCOS same as PCOD? PCOD is polycystic ovarian disease. Is it same as polycystic ovarian syndrome? Well, no. Polycystic ovarian disease is the light form of PCOS. So you need to understand the difference before you treat yourself. So let me show you a comparison of PCOD with PCOS. So both of them are basically a hormonal disorder, but in PCOS, endocrine and metabolic disorder is predominant. Your egg release is disrupted and ovulation usually stops in PCOS, right? But in PCOD, immature eggs are released. In terms of severity, PCOS is more severe. In terms of fertility, it will hamper the production of your eggs, and once that happens, the person becomes infertile. In PCOD, it is usually unaffected. Long-term health risks are more affected in PCOS as compared to PCOD, and the symptoms are more severe in PCOS. What kind of investigations you need to do in PCOS? It is important to screen yourself before you diagnose yourself, right? So there's a different kind of workup that needs to be done. For example, you need to have an ultrasound, uterine ultrasound, transabdominal ultrasound, or ovarian ultrasound. Your healthcare provider will do all of these ultrasounds to check what category of PCOS or what severity or what phenotype that do you lie in. You need to have your hormonal profile done, LH, FSH, estradiol, prolactin, progesterone, and most importantly, your androgen index should be done. Other risk factors which should be excluded are your thyroid profile, because sometimes the TSH, T3, T4 levels are unbalanced, and that could be the reason of your PCOS, which needs to be rectified. Your iron levels should be checked. Therefore, your iron reserves as ferritin. So whenever you go to your health provider, they will get all of these lab tests done before diagnosing you according to the Rotterdam's criteria. So there are other diseases which needs to be ruled out of PCOS, because we also do some exclusion criteria before labeling anybody with PCOS. So dexamethasone suppression test has to be done to rule out cortisol levels. HbA1c or your fasting glucose should be checked, that how much insulin resistance you are. Your 24-hour urine cortisol and creatinine should be checked to rule out Cushing syndrome, right? And your beta HCG levels should also be checked, just in case you're already pregnant. So, does this PCOS have any burden on healthcare and your quality of life? Yes, it does. It does have a lot of burden on the healthcare industry, and not only that, but also your health and your quality of life. So let me show you a research done in the National Institute of Health, and it shows that PCOS has a negative impact on health-related quality of life. Not only your physical functioning, your physical role function, your bodily pains, and overall your general health, your social function, because you won't be interacting much with people, so your environmental role function, and most importantly, your mental health well-being is affected, which is so important for your life. What are the side effects of the PCOS medications? Because obviously, once you're diagnosed, you will be prescribed some medications, usually metformin, progesterone, some birth control pills are prescribed. But if your condition is according to your healthcare provider is severe enough to take those, well ahead, go ahead with those. But there are some times you don't need medications. You can manage them at your just by taking supplements or by changing your lifestyle. Let's see what are the side effects before I move on to your lifestyle changes. So one of the side effects of the metformin is nausea, abdominal discomfort, diarrhea, metallic taste in mouth. This is one of the symptoms that patient comes in, then they say they can't understand whether they're eating ice cream or whether they're eating some other sweet dessert. Loss of appetite. Metformin is also contributes to B12 deficiency. You will have generalized symptoms like headaches, fatigue, and weight loss. So these are the general side effects. You might have it, you might don't have it. So this is just for your education, that if you're taking metformin, these are the side effects you might encounter. So you should not get worried, okay? You must talk to your healthcare provider what kind of treatment changes can be done. There's another kind of birth control pills that are prescribed in PCOS. So I'm just showing you a slide to summarize what kind of side effects you can have from these. You will have reduced libido, like reduced sexual drive in women and men both. You might have vaginal thrush, or which is also called vaginal yeast infection, breast soreness, mood swings, may have mid-cycle spotting, and generalized fatigue, nausea, and headaches. So these are just the common side effects that you see during taking these medications. So how should the management be done in PCOS with nutritional based medicine? So the goal is to improve the skin symptoms, to restore menstrual functional, restore infertility, improve the quality of life, and protect from long-term health problems. So these are the main goals that has to be done for managing the PCOS using evidence-based nutritional medicine. What is the overview treatment? Is basically having lifestyle modification or other pharmacological treatments. But right now we'll be talking about what are the other or alternative therapy that is available. So let's talk about importance of circadian rhythm in PCOS. Once you have a PCOS, there are sleep disruptors as well. For example, you might have sleep apnea. Obviously, you are facing insulin resistance. You might have high imbalanced cortisol, which leads to stress, anxiety, and trauma. Decreased melatonin. Melatonin is a hormone which is responsible for the production of, which induces sleep in your circadian rhythm. And once that is low in quantity in your blood, it'll affect your sleep anyways. So low progesterone and low estrogen levels and very low quantities of these hormones are basically contribute to sleep disturbances. Let's talk about how we can make them balance, right? So the cortisol levels in the PCOS are usually higher. So if you follow the evening and the morning routines to balance your sleep cycle, so that will reduce your cortisol level. Cortisol is the stress hormone in your body, so that will reduce in amount in your blood, and ultimately your melatonin production will be increased, and hence your sleep is improved. So once your sleep is improved, your repair system is in balance and your PCOS symptoms are reduced as a consequence. We also recommend having inositol in the management of the PCOS. Let me clarify what are the benefits of inositol. It decreases insulin resistance, it improves the skin, it improves the redness of your skin, it reduces the excess hair growth, promotes ovulation, it regulates the menstrual cycle, improves the egg quality, which is important for your fertility, decreases the testosterone in case of females, but in case of males, it improves the testosterone, it lowers the cholesterol levels, lowers the blood sugar because your insulin is in check by your pancreas and also your cell, and it reduces the anxiety and the cortisol levels. So understanding that how inositol is important in PCOS is going to regulate all of these symptoms and reduce the overall management of the PCOS. Let's talk about the dietary management in PCOS. You need to have low glycemic index foods. So what are the restrictions? Your highly processed foods are restricted. So let me clarify what is high glycemic index diet. Your pasta, your white rice, your white bread, your processed sugar is all your chips, which you like to eat every time, your ice creams you like to eat every time. These all are in the category of high GI foods. Well, I'm not asking you to ban those. I'm just asking you to keep a check balance in your diet. If you are suffering from any of the symptoms of PCOS or any of the criteria that I have discussed, you better regulate your diet. You better have a check and balance whether you're having a high GI food or whether you're having a low GI food, because you have to have a preference. So what are the low GI index foods? Basmati rice or brown rice. High fiber foods like vegetables, lentils, whole grain breads, oats. Those all lie in the category of low GI index foods. So you need to understand what are highly processed foods as well, because those needs to be reduced, better stopped unless you are cured, right? So let me show you how do we categorize the processed foods. There are group 1 to 4, low processed to higher processed. So the group 1 includes the unprocessed or minimally processed foods like your vegetables already cut, available in the market. Better you buy them organic, you get them, wash them yourself, because lots of pesticides these days. If you can afford, go for organic ones, get them cut yourself, meal prep if you don't have time, right? And group 2 includes the culinary ingredients like your vinegar, like already processed honey, cheese, butter, right? But all of these groups, you can't take it if you are suffering from PCOS. Better to avoid those group of processed foods. The group 3 includes your breads, highly processed, better if you can make it in your home. I know these days people don't have time to make breads at home. I understand that. But there are different varieties in the market these days. You can get them looking at the ingredients. Make it a habit of looking at the ingredients. Because in the market you'll see lots of breads with additives, with lots of preservatives. A lot of bread improvers are added. You might get allergic to it. You don't know it, right? A lot of processed cheese, canned foods, they all lie in the group 3 of this food category. And then the last but not the least, the group 4, the Coca-Cola. I didn't want to take a name, but all of the soft drinks, the processed, highly processed and highly salted chips, one of my favorites as well, ice creams, hamburgers, sweet milk chocolates, all readily available, taken as a snack. You should understand your condition and make good healthy choices in your lifestyle and in your food buying as well. So these were the dietary restrictions, right? But everyone is not the same. So if you think that you are suffering from any of this disease or any of the symptoms, you can always contact us, or you can contact your healthcare provider and get yourself checked, get yourself diagnosed properly, and then definitely you can have a consult with us, and then we'll guide you better on what nutritional adjustments you need to take. Let's talk about the real case study of PCOS. It's one of the interesting case study done in scientist home, and then let me show you what were the health concerns and the medical history. So she was a beautiful lady, 22 years old. She came with the health concerns of acne on her face and body, painful bumpy skin, painful periods, unable to sleep. Most of her relationships were affected. She had a poor health, mental health because of all of these conditions. So a treatment was advised to her, which she followed for 2 to 3 months. And you'll be surprised to see the results. Like within just 2 to 3 months, the improvements were gained, a significant reduction in all of the symptoms, around 80 to 90%, and her personal goals were achieved. Let me show you the before and after of this. So this is the before. As you can see, her face was all covered with acne marks, acne scarring, and red acne already all over face. She was in such a bad mental state because of that lack of confidence. Obviously, enduring all those symptoms was playing havoc on her overall well-being. So let me show you the during picture. So from that acne full of face, acne is reduced pretty much during the treatment. As you can see in the first picture and the second picture, this was in the middle of the treatment, and this is the before and after. A complete comparison of before and a clear skin after. let me show you the another picture. So it was before from the face and after the client. So these were the main, as you can see. Let me show you again, before and then after. It's an amazing result. If you think that you are suffering from any of such condition, you can consult us. I'll be showing you the WhatsApp number afterwards. You can consult us, take an appointment, you can come to our health center and have a detailed discussion about your condition. Bring your any reports if you have already done. If not, might be able to get them done in our collaborating lab in our center. We'll give you a detailed overview of your health concern. We'll guide you on the evidence-based nutritional therapy or rehabilitation if you need, and analyze your report, suggest you what kind of combination of supplements we can provide, and we can suggest in overall management of your condition. So thank you so much. It was this was one of the presentation for today, and I'll come back with another presentation next time. You can comment if you want to know any of other health disease on Facebook or YouTube live broadcast that we've done. You can always message us on WhatsApp as well. Thank you so much. This is me, Qurat, signing off from Let's Talk Health. See you next time. Bye-bye.